Hi, my name's Joey Looker. I'm a student PTA
Hi,
here at South University. What's your name?
my name is Miranda Strawberry.
Ren Strawberry. Nice to meet you. How are you feeling today?
Terrible.
Terrible. A lot of pain.
Terrible. So much pain.
Okay. So can you explain to me what exactly happened?
Okay, all right. I work at a power plant
Yeah.
over in Troy,
Mhm.
and I was driving on the interstate trying to get back home. I work
Mhm.
from 9 to 5, and so as I was driving on the interstate, I drive in a Lexus, right?
Okay.
No, it's
Nice.
a pretty decent sized car.
Mhm.
Then this car in front of me, it was a gray Kia Soul, and for some reason he just slammed on brakes for no reason. For
Mhm.
no reason, he just slammed on brakes, and I had to swerve to get out the way to stop from running into the back of
Mhm.
him. I ended up going headfirst into the wall that separates the two lanes,
Mm.
and ended up getting into a direct crash. Ended up hurting my hips.
Are your hips? Yeah. So where exactly is your pain?
I forget what that guy said. He said I fractured my robot or something like that. I
Yeah.
forget.
So what happened is you fractured your pubic rami, which is a part of the anterior ring of your pelvis, and that is and you also fractured it superior and inferiorly. So you fractured it on the top part of the ring and the bottom part of the ring, and you also fractured it on both sides. And so that's probably why you have a lot of pain. That's probably why you're very limited in your hips from moving from this way out and back in, because these muscles right here are probably limiting a lot of that motion.
All right, that makes sense.
Yeah.
I guess.
Yeah, and it actually was good. They came back with tests and said that you didn't have any internal organ damage, so that's good. And also, your fracture was a sustained non-displaced fracture, and so what that means is the fracture is still together, all the bones, and they're not all in different spots and in pieces, and so the healing process is much quicker. And there's also no surgery.
All right, well that's some good news, I guess.
Yeah, and so what we're going to do today is we're going to work on your range of motion. We're going to do some exercises to help with blood flow. We're going to do some special tests. The special test specifically is going to be a DVT, and that's going to help give you, or it's a good indicator if you have a blood clot or not. Because you're also going to be in bed for 5 to 6 weeks, and that's what the doctor ordered. You're going to be on bed rest for 5 to 6 weeks, and then also you're going to be in the hospital for 7 to 8. So testing for blood clots, yeah. Testing for blood clots. Also, you're on birth control, which that increases your risk for blood clots as well. And so we're going to do that test. We're also going to do some exercises to help increase that blood flow and help prevent muscle atrophy. I'm also going to do some range of motion tests. Now, what that is we're going to measure the motion specifically in your hip flexion to see how many degrees of motion you have. That way, we want to increase this motion, this hip flexion motion, so that we can go from your back and then we can go into sitting. Because I don't want you to have any pain when you sit up.
Okay.
Okay?
Okay. Go back to that 7 to 8 week things you were talking about.
Mhm.
I gotta have to get back to work, and me
Yeah.
and my husband, we plan on going hiking in the Poconos Mountains in February.
Mm-hmm.
So is there a way we kind of speed that process up? Or no?
As long as you do your exercises and obey the doctor's orders for staying in the bed 5 to 6 weeks and get as much exercise and as also rest as you can, I think you might be cutting it close, because you're going to be in here 5 to 6 weeks, and then you get out in 7 to 8, and then from there you're going to go to an outpatient facility. But before you leave here, we're going to make sure you're still walking and functioning, and then we're going to take you to an outpatient to get you more treatment.
Okay. All right.
All right. So I'm gonna start out with measuring your hip flexion range of motion. So what I'm gonna do is I'm gonna lay you down flat. Okay.
All right.
Relax. And also with your pain, how bad is it today?
Right now, even just sitting here, it's an 8. I don't give it. It's bad. It's terrible.
Yeah. So 0 out of 10. 0 meaning you have no pain. 10 meaning you have very severe pain. 5 meaning you have pain but it's bearable. And so you have about an 8, which is pretty bad, right?
I can't barely stand this. I can't even stay still.
I know it's probably very discomforting. With movement, say when you move around a little bit, how much pain pain you say you have, based on that same scale from 0 to 10.
Shoot, 10 is as bad as it can get, so I have to give it a 10.
A 10? That's pretty bad.
Yeah.
So what we're going to do is also, we have a modality for you, which modality is, we're just going to have an ice pack, and what that's going to do is we're going to place it on this side, and then have it on there for 15, 20 minutes, and then we're going to place it on that side, okay? Alright, and so I'm going to go, do some hip range of motion. Okay, we'll measure this side first. I'm also going to measure both sides just because I want to see what range of motion you have in both sides. Okay. All right. And so what I'm going to do is I'm going to keep you covered and draped, so you don't have to worry about that.
Easy.
There we go. How's that? Is it comfortable?
As comfortable as I can get.
Okay. And so in your charts, you had about 50 degrees of hip flexion. So we want to go to about that same distance and maybe a little further, depending on your pain. Now, if you have very severe pain, we don't want to go any more than that, because that's going to be that's going to hurt the healing process as well if we go any further. Okay. All right. So with your stationary arm, this is just where we line it up with the mid part of your abdomen area to the lateral side of that, and then also the axis is going to be on your greater trochanter, which is part of your hip bone. It may also be known as your hip bone. Okay. All right, and so then the moving arm, which is how we get the measurement, that's going to be on the lateral side of your thigh, also lined up with your lateral epicondyle, okay?
Wait, what? Lateral? What is that? What's epicondyle?
It's just lateral side part of your knee right here. So, right there.
Okay.
Yep, all right. And I'm going to lift your leg up, and we're going to get that range of motion. I want you just to relax, okay?
Okay.
Tell me when you start feeling pain, okay?
All right. Oh, right there.
Right there?
Yeah.
Okay.
Right there. Ooh. Let me down.
So you had about 66 degrees of pain. 66 degrees range of motion, which is an improvement from last visit when you only had about 50. Okay.
Okay.
All right.
That's good.
I'm also going to measure this other side. Going to keep you draped here, okay? And same thing on the other side, same measurements, same points, okay?
Okay. Tender.
Mm-hmm. Okay, same thing. We're gonna lift your leg up.
All right. What's the thing right there?
Right there?
Right there. Yeah.
Okay.
Yeah, there we go.
All right. You're right at 48 degrees, which is a slight decrease. Maybe you just have a lot of muscle spasms today in your hamstrings and the back of your thighs, and also with pain, which we're gonna do a modality to decrease that. Okay. We're also going to do muscle testing, and the muscle testing that I want to do is for your quad muscles, which is the top part of your thigh, and that's with this knee extension, making your knee go straight like that. This is also very beneficial for when we get you to the position to sitting. That way you can stand up. Okay, we want to get you back standing. That way you can go hiking, right?
Yeah. Definitely.
All right, and I'm going to measure both sides. Okay.
Okay.
And what I want to do is I'm going to support under your thigh, and I want you to try to lift your leg up and into where your knee is straight. Okay?
All right.
All right. Okay, and again, I'm going to drape.
This muscle looking pretty big, going from the hip to the knee.
Yeah, it goes from right here